I want to welcome you to another class of the redoxdoc.com video lecture series. This class focuses on gastroesophageal reflux disease, GERD, or acid reflux for short. It's a common problem, and it has connections to our cellular health. It is not just a problem of having too much acid. It really isn't it. So let's talk about what it has to do with, and then we'll get along to some cellular solutions that I think you'll enjoy. So reflux disease affects about 20% of our population in Western countries, and it's characterized by a taste of acid in your throat, heartburn, bad breath, chest pain, vomiting, cough, loss of the enamel of your teeth, esophagus strictures from scarring, and something called esophagitis, which can lead to cancer of the esophagus. This is not a small problem. And let me just kind of show you, well, these are not the best diagrams of our body, but so here is the esophagus coming down from our throat. It crosses the diaphragm where our lungs are here, and the stomach is below there, and it empties into the small intestine. Normally, there's a muscle called a sphincter at the top of the stomach that's part of the anatomy of the esophagus, and it's attached to the diaphragm. And so this muscle relaxes when we swallow, and it tightens when we're done to prevent stomach acids from getting back up the esophagus. So there's how it normally works. Sometimes people have a weakness in this sphincter, and they actually have a little bit of the stomach that slips up into the chest cavity. It's called a hiatal hernia. And sometimes that weakness is just allowing acid to travel back up the esophagus. So treatment has revolved around, well, what could we do? Well, we could decrease the acid in the stomach. So we have, over the years, used things like antacids. So Tums and Maalox, those were the things that were used back in the 60s and 70s. Then came along something called H2 blockers called Tagamet and Zantac. And these actually block a certain receptor in the stomach that allows acid to be produced. And those work pretty well. And they have been replaced by something more powerful called a proton pump inhibitor. So when you think of the purple pill and some of the common now over-the-counter products, like Pepsid, that is actually a proton pump inhibitor, and it further decreases acid in our stomach. Well, the trouble is that doesn't always help, and there are side effects to taking these pills, like leading to osteoporosis in our bones. So even when this gets really severe, occasionally there are surgery where they try to tighten up that sphincter and swing around part of our small intestine and wrap it around that thing. So the goal here is really to try to prevent this acid from damaging the esophagus and leading to serious trouble. So we know there are risk factors for this. When you're overweight, there's too much pressure in your abdomen. It kind of forces everything up. During pregnancy, this is a natural thing, but many women notice they get terrible heartburn for the same reason. Smoking is also a risk factor because it increases the acid production in our stomach and makes our cells more vulnerable to oxidative stress and trouble from the acid itself and unable to repair. Alcohol also causes erosion in the esophagus, ulcers in our stomach, and increases acid. So it's like putting acid down in our stomach because it's very acidic, alcohol is. So oftentimes, if it's short-lived, using these medicines are very safe and not a problem. But if you're going to take them over a long period of time, definitely these guys are not safe. These guys are much safer. If you can just get by with a tiny dose that helps you, great. We also know that certain foods are irritating, spicy foods, acidy foods, and that sort of thing will oftentimes irritate the mechanism of keeping that sphincter tight. By the way, caffeine also relaxes that sphincter, so coffee and tea are not good for reflux disease. Okay, so I want to share with you a little research study that I found, and this study is fun because they actually took biopsies of the esophagus. They studied, I think it was around 100 patients. So here's what we know. We know that free radicals are involved with the acid damage in the esophagus, the damage to the cells. We know that free radicals are involved with that. So in this study, they biopsied this esophagus in 100 patients who had esophagitis and reflux disease. And in the tissue analysis, they actually measured in the tissue, not the bloodstream, in the tissue, SOD, catalase, and glutathione. So that was a tissue analysis. And what they found was that in particular, superoxide dismutase had extremely low tissue activity. And so in that same biopsy, they found evidence of increased free radicals in the same tissues where this was extremely low. They saw high levels of free radicals, superoxide anions and peroxynitrate radicals. These are bad players. So all of this led to cellular damage. So in the worst of cases, these were the most apparent. And in the milder cases, this was mild. So what do you think? What could we do here to help these cells, help them recover, help them not be so beat up by these free radicals? Well, the obvious solution is to restore cellular integrity at a foundational level, deep within our cells. So the first thing we would want to do is improve our redox balance. Redox molecules are the molecules of healing. They need to be in balance in our cells, between our cells. They're the first signals for the body to do healing with, the first sign of trouble for our immune system to find out what's going wrong is they'll see a redox molecule that's been released in a pulse when a cell is under attack from an acid or from a free radical, okay? And so when we have an abundance of redox molecules, we have the opportunity to initiate healing and to maintain cellular functions. Number two, we want to increase the efficiencies of our antioxidants. And we know that every one of our antioxidants require charged particles to neutralize the toxins with. So unless they have these molecules about them, redox molecules nearby, the negatively charged ones, that they can match up with a toxin, then the efficiency of antioxidants is maintained. And thirdly, we want to do something to help improve the production of antioxidants in our cells. Wouldn't that be great? And maybe this could help in some way. So when we green up our diet, when we are helping maintain a proper balance, we'll stimulate those nuclei in our cells to produce antioxidants. It's part of a natural cell cycle, and it will occur if our body is in balance. So every one of these things by itself would be good, but what would you say if you could do all three at once? And the solution to that is to find a redox supplement. As you put these molecules in your body, you restore redox balance, you activate the efficiency of our antioxidants, and you signal the increased production. And all three happen at once simultaneously. So it's one great way to help create a restoration of our cellular integrity in one single action. And of course, any one of these things may help by itself. This is not necessarily saying that you're going to cure reflux disease. That's a big problem. You may need to do a variety of things. Lose weight, stop smoking, take a little medicine with the help of your doctor, but take care of yourself at a cellular level. This is absolutely one of the most foundational things we can do to restore our health. So I hope that's helped you get a picture of this problem of reflux disease, and bon appetit. Have a great meal, but be careful about what you eat because it may cause some heartburn. Bye for now.